I play and you play. I play and you play. I play, you play. ನಾನು ನುಡಿಸ್ತೀನಿ, ಅದಾದ್ಮೇಲೆ ನೀವು ಮಾಡಿ. to the group.
Good morning, one and all. On behalf of NIMHANS and the Department of Neurology, it's a pleasure and privilege to welcome all of you to the Karnataka Brain Health Initiative Reflection to Action Program. I'm Dr. Madhu, Additional Professor, and this is Dr. Pooja, Associate Professor. We are from the Department of Neurology, NIMHANS, and we're going to be comparing today's program. We've just had the community drum circle led by the very energetic and exuberant Ms. Varsha and her team from the Community Drum Jam Foundation, initiated by the talented and committed duo, Mrs. Vasundhara Das and Mr. Roberto Narayan. All of you will agree that this has been a 45-minute, well-spent creative activity to beat the stress and build communities. The way drum beats resonate and entrain self with the environment, improve expression, communication, and self-esteem. And this is so important for healing patients with neurological disorders. In a unique way, the drum beats have set the perfect rhythm for today's program. The Karnataka Brain Health Initiative is a one-of-its-kind drive to take the state-of-the-art knowledge and technology to the community grassroots levels, bridge the treatment gap, and improve efficiency of healthcare delivery to patients with common neurological disorders such as stroke, epilepsy, headache, dementia, and infections.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಿಮ್ಹಾನ್ಸ್ ಮತ್ತು ನ್ಯೂರಾಲಜಿ ವಿಭಾಗದ ಪರವಾಗಿ ಕರ್ನಾಟಕ ಇನಿಷಿಯೇಟಿವ್ ಕಾರ್ಯಕ್ರಮ ರಿಫ್ಲೆಕ್ಷನ್ ಟು ಆಕ್ಷನ್ ಸಮಾರಂಭಕ್ಕೆ ಸ್ವಾಗತಿಸುತ್ತೇವೆ. ಶ್ರೀಮತಿ ವಸುಂಧರಾ ದಾಸ್ ಅವರು, ಶ್ರೀ ರಾಬರ್ಟ್ ನರೇನ್ ಅವರು, ಶ್ರೀಮತಿ ವರ್ಷ ಅವರು ಮಾಡಿದ ಈ ಡ್ರಮ್ ಜಾಮ್ ಅಲ್ಲಿ ಸಾಕಷ್ಟು ಉತ್ಸಾಹವಾಗಿದೆ. ಇದೇ ಉತ್ಸಾಹದಲ್ಲಿ ನಾವು ಮುಂದುವರಿಸೋಣ. ಕರ್ನಾಟಕ ಮೆದುಳು ಆರೋಗ್ಯ ಅಥವಾ ಬ್ರೈನ್ ಹೆಲ್ತ್ ಇನಿಷಿಯೇಟಿವ್ ಅತ್ಯಾಧುನಿಕ ಜ್ಞಾನ ಮತ್ತು ತಂತ್ರಜ್ಞಾನವನ್ನು ಸಮುದಾಯ ತಳಮಟ್ಟಕ್ಕೆ ಕೊಂಡೊಯ್ಯಲು, ಚಿಕಿತ್ಸಾ ಅಂತರವನ್ನು ಮಿಗಿಸಲು, ಈ ಪಾರ್ಕಿನ್ಸನ್ಸ್ ಡಿಸೀಸ್, ಸ್ಟ್ರೋಕ್, ಅವಸ್ಮಾರ, ತಲೆನೋವು, ಬುದ್ಧಿಮಾಂದ್ಯತೆ ಇಂತಿಷ್ಟು ನರ ಸಂಬಂಧಿ ಕಾಯಿಲೆಗಳನ್ನು ಹೊಂದಿರುವ ರೋಗಿಗಳಿಗೆ ಆರೋಗ್ಯ ಸೇವೆ ಮತ್ತು ಸುರಕ್ಷೆಯನ್ನು ಸುಧಾರಿಸಲು ಒಂದು ಚೊಚ್ಚಲ ಆಂದೋಲನವಾಗಿದೆ. ಎಲ್ಲರಿಗೂ ಸ್ವಾಗತ.
This program has been made possible by the concerted and combined efforts of the Government of Karnataka and NIMHANS in consultation with the NITI Aayog, and for the first time, doctors and physicians from PHCs have been certified to treat the common neurological conditions. To grace today's program, we have with us the team of mentors, clinicians, educators, and administrators who have played a vital role in conceptualizing and materializing this project. We now request Professor Pratima Murthy, Director NIMHANS, and Professor B. Shankar Narayan Rao, Registrar NIMHANS, to accompany our chief guest and dignitaries onto the dais. We have with us Dr. K. Sudhakar, the Honorable Minister for Health and Family Welfare and Medical Education, Government of Karnataka, Professor K. Vinod Paul, Honorable Member, NITI Aayog, Government of Karnataka, and Sri Randeep D, Commissioner, Health and Family Welfare Services, Government of Karnataka. Let us commence today's program by invoking the blessings and guidance of the Lord Almighty. May I request Ms. Pratima A.R., PhD scholar in the Department of Clinical Psychology, NIMHANS, to render the invocation song.
गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेश गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुक मनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलक्षेत्रे गुरुधर्म सदाराध्याय गुरुपुत्र परित्रार्थे गुरुपाखण्ड खण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय बालचन्द्राय श्रीगणेशाय धीमहि श्रीगणेशाय धीमहि श्रीगणेशाय धीमहि. Thank you. Thank you, Ms. Pratima, for that melodious rendering. Professor Girish Chandra Rao, Professor of Epidemiology, NIMHANS, and a public health expert, has been spearheading the Karnataka Brain Health Initiative and is the key player who is actually involved in implementing the comprehensive community-based model of care in 3 districts of Karnataka. May I request Professor Girish Chandra Rao to deliver the welcome address.
ಗುರು ಹಿರಿಯರೇ ಹಾಗೂ ಆತ್ಮೀಯರೇ ಎಲ್ಲರಿಗೂ ಆದರದ ನಮನಗಳು. A very good morning and greetings to all. ದಾರ್ಶನಿಕ ಕವಿ ಡಾಕ್ಟರ್ ಡಿ.ವಿ.ಜಿ. ಶರಣು ಹೋಗು ಜೀವ ರಹಸ್ಯದಲ್ಲಿ ಸತ್ವದಲ್ಲಿ ಶರಣು ಜೀವನವ ಸುಮವನಿಪ ಯತ್ನದಲ್ಲಿ ಶರಣು ಅಂತರಾತ್ಮ ಗಂಭೀರ ಪ್ರಶಾಂತಿಯಲ್ಲಿ ಶರಣು ವಿಶ್ವಾತ್ಮದಲ್ಲಿ ಮಂಕುತಿಮ್ಮ ಅಂತ ಹೇಳಿದ್ದಾರೆ. It is in this spirit that we propose today's welcome. India as a country and also as a civilization has always lauded itself in its stature as being the knowledge powerhouse. Hence, we see a larger emphasis on swasthya and particularly chitta swasthya. Ensuring brain health thus has been a natural endeavor. We have gathered here today in the larger schemata of celebrating our journey in the implementation of Karnataka Brain Health Initiative, KABHI, not just Kabhi, but Abhi. Vinod Paul sir, I am stealing your term of calling to this event as a celebration. The conceptualization of Karnataka Brain Health Initiative has been made possible because of this initial confluence of 3 streams dedicated to the welfare of the citizenry of India: Department of Health and Family Welfare, Government of Karnataka, Niti Ayog, and NIMHANS. In this journey, other streams have joined and in future will join to nurture the goal of setting a public health model for neurological disorders. Elders and friends, I take this opportunity to welcome all our dignitaries who are present. I would request them to accept this token of memento from us. I would request Dr. Sudhakar, our Honorable Health Minister, to accept this memento. Sir, we all know in public health how leadership makes a big difference. Thank you for being our leader and guiding us from front. I request Professor Vinod K. Paul to receive this memento from our side. Niti Aayog has been catalyzing a lot of endeavors. Sir, warm welcome, sir, for accepting and catalyzing this endeavor, for stimulating us and also making this possible. I would now like to formally welcome our director, Professor Pratima Murthy, who is the brain of this whole endeavor. Sorry, I would say the mind of this entire endeavor. Madam, a warm welcome. I'm sure it would not be out of place if I say Mr. D. Randeep, our health commissioner, is a source of perspiration for all of us. Sir, I'm not mistaken in telling it, but you have given us a larger job of trying to look at expanding the Kabhi to entire state of Karnataka. Warm welcome, sir. On all your behalf, I would like to welcome our beloved registrar, Dr. Shankar Narayan Rao. In terms of brevity of time, because sir has to leave early, I would just like to extend a warm welcome to all the dignitaries who are here. The scientific advisory group members, Dr. Prashant Mathur is here. We have others who have joined online. Our Director of Health Services, Dr. Indumati Madam is here. A warm welcome to all of you. A warm welcome to Dr. Dean Hiraja, our former director. Thank you very much. Please give a big hand to all who have made this today's celebration and our journey possible. Thank you.
We traditionally light the lamp to mark the auspiciousness of the occasion. May I request the dignitaries to kindly light the lamp?
आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तुते मोदी।
Now it is my privilege to invite Dr. K. Sudhakar, the Honorable Minister for Health and Family Welfare and Medical Education, Government of Karnataka. Dr. K. Sudhakar is committed to reforming, upgrading and transforming the healthcare services in Karnataka. A dynamic personality, Dr. Sudhakar is always up to date with the nuances of the people's responses. He is able to feel the pulse of the healthcare system and he endorses and supports all healthcare activities. It is an honor to have you with us, sir. May I request you to kindly address the audience?
ನಮಸ್ಕಾರ. ಕಳೆದ 2-3 ದಿವಸದಿಂದ ಬೆಂಗಳೂರಿನಲ್ಲೇ ಇವತ್ತು ಇದ್ದು ಅನೇಕ ಆರೋಗ್ಯ ಕಾರ್ಯಕ್ರಮಗಳಲ್ಲಿ ಯೋಜನೆಗಳಲ್ಲಿ ನಮಗೆ ಬಹಳ ಉತ್ತೇಜನವನ್ನು ಕೊಡ್ತಾ ಇರ್ತಕ್ಕಂಥ ನೀತಿ ಆಯೋಗದ ಗೌರವ ಸದಸ್ಯರು ಆಗಿರ್ತಕ್ಕಂಥ ಶ್ರೀ ಡಾಕ್ಟರ್ ಪ್ರೊಫೆಸರ್ ವಿನೋದ್ ಕೆ ಪಾಲ್ ಅವರೇ, ನಮ್ಮ ನಿಮ್ಹಾನ್ಸ್ನ ನಿರ್ದೇಶಕರಾಗಿರ್ತಕ್ಕಂಥ ಡಾಕ್ಟರ್ ಪ್ರತಿಮಾ ಮೂರ್ತಿ ಅವರೇ, ನಮ್ಮ ಆರೋಗ್ಯ ಇಲಾಖೆಯ ಆಯುಕ್ತರು ಆತ್ಮೀಯರು ಆಗಿರ್ತಕ್ಕಂಥ ರಣದೀಪ್ ಅವರೇ, ಅದೇ ರೀತಿ ನಮ್ಮ ಡಾಕ್ಟರ್ ಬಿ ಎಸ್ ಶಂಕರ್ ನಾರಾಯಣ್ ರವರೇ, ಡಾಕ್ಟರ್ ಸುವರ್ಣ ಅವರೇ, ಡಾಕ್ಟರ್ ನಾಗರಾಜ್ ರವರೇ, ಡಾಕ್ಟರ್ ಅರುಂಧತಿ ಅವರೇ, ಡಾಕ್ಟರ್ ನಮ್ಮ ಭಾನುಮೂರ್ತಿ ಅವರೇ ಮತ್ತು ಮುಂಭಾಗದಲ್ಲಿ ಹಸೀನರಾಗಿರ್ತಕ್ಕಂಥ ಅನೇಕ ನಮ್ಮ ಆರೋಗ್ಯ ಇಲಾಖೆಯ ಹಿರಿಯ ಅಧಿಕಾರಿ ಮಿತ್ರರೇ, ನಿಮ್ಯಾನ್ಸ್ನ ಎಲ್ಲ ಪ್ರಾಧ್ಯಾಪಕ ವೃಂದದವರೇ ಮತ್ತು ಹೆಸರಾಂತ ಕಲಾವಿದರು ಆಗಿರ್ತಕ್ಕಂಥ ಇವರಲ್ಲ ವಸುಂಧರ ದಾಸ್ ಅವರೇ, ಇವತ್ತು ಬಹಳ ಸಂತೋಷ ಆಗ್ತದೆ. ನಮ್ಮೆಲ್ಲರ ಕನಸು ನನ್ಸಾಗ್ತಾ ಇದೆ. ಅದಕ್ಕೇನೆ ರೈಟ್ಲಿ ಯು ಸೆಡ್ ಇಟ್ ಇಸ್ ಎ ಸೆಲೆಬ್ರೇಷನ್. This was only just a thought. Now it has transformed into action. I really acknowledge for the kind of support the Niti Aayog under your able leadership is giving us. And we are fortunate in having an institution like NIMHANS in Bangalore, who is taking a lead in this brain health initiative. Last but not the least, our health department. Without their support, it would be impossible to deliver these brain health initiative across nook and corner of this Karnataka state. We all know how important brain health is. We have improved the lifespan, but it is not how long we live, how well we live is our philosophy. So that is why without a sound or without a good mental health, one cannot be called as healthy. Today we know that after NCDs, it is this infections, like there's so many infections pertaining to brain, CNS, that is bothering the modern society. Today, in the last 10 years, in all the analysis, statistics say that there is a neuropathy, increase in neuropathy, increase in strokes, epilepsy, dementia, schizophrenia, headache, and head injuries. And the second highest killer disease is stroke. It is anywhere estimated between 7 to 8% of all the deaths that is occurring. And these deaths can be prevented. When diagnosed early, we can definitely prevent these deaths. And Brain Health Initiative is one of the unique ideas, innovative idea that our government has pioneered and started it, and really thank the government of India under the leadership of Niti Aayog. They are trying to roll out this nationally now. NIMHANS. So there is another hub and spoke model from NIMHANS where we have, as a pilot, we have taken 3 districts, Chikbalapur, Kolar and Bangalore rural, where we are training even our PHC doctors to treat or to understand or to even how to counsel these kind of patients or people who need support. So in the long run, we want to expand this, not just to 3 districts, we want to expand this to the entire state. As a state, we are very committed. This government is very committed to cater to all our people, not just the physical health, we want to promote their mental health as well. So this, we feel that it is our responsibility and we would do our best. And I would like to only reassure this mission that this state government, our department in particular, we are very focused and we are very committed for the cause and will support you in every requirement financially. And as a health department, we have huge human resource with us. They will be specially assigned the responsibilities under the leadership of our Commissioner Health, Mr. Randeep. I think is spearheading from the Health Department, and similarly Dr. Rajani, who is also the DD of our department, quite passionately he is aligned to this cause. So today it was a very meaningful gesture to start with drumming. And we all know that doctors, not only doctors, people who had these issues, the patients, few patients also joined this session, and it's a very meaningful session. And lastly, Dr. Suvarna and Dr. Girish, the team is doing splendid job, and they are taking to every nook and corner, and very happy that all our doctors, they have completed 3 months of training already. It's been 3 months and they're all trained today. And from after doctors, I want even my ANMs, CHOs, even ASHA Karyakartas to be trained in the next stage. That is how our entire health machinery should be able to manage the crisis, acute crisis, and sometimes long-term counseling effects also will help greatly and immensely. So I again acknowledge and congratulate all the stakeholders to have been doing such a stupendous job. Namaste. Jai Hind, Jai Karnataka.
Thank you, sir. We look forward for your continued support to take forward the reflections to action under your esteemed leadership. Professor Vinod K. Paul is the honorable member.
Thank you. Yes, it's after Vinod.
Professor Vinod K. Paul is the honorable member of Niti Aayog, the policy think tank of Government of India. May I request you, sir, to kindly-
अभी दोबारा मैं बोलूंगा तब करेंगे अभी तो मुझे so namaskaram, good morning. Dr. K. Sudhakarji, Honorable Minister of Health, Family Welfare and Medical Education, Government of Karnataka. Dr. Pratima Murthy, Director NIMHANS. Shri D. Randeep, Commissioner Health. Registrar of NIMHANS, Dr. Shankar Narayana Raoji. Dr. Nagaraj, distinguished faculty of NIMHANS, Dr. Indumati, my team from NITI, and all our health workforce from the community where this special mission is being undertaken. So we're very honored with your presence in this celebration of Karnataka Brain Health Initiative, K Abhi, not Kabhi, but K Abhi, Karnataka Abhi. तो आइए सेलिब्रेशन है सर, आपने इसको शुरुआत करी, एक मौका बना, stars got aligned. We had wonderful leadership from NIMHANS giving us triggers, NITI team, Ministry of Health and Family Welfare, and of course, because of your leadership, sir, this whole thing got materialized because it's about action and on the ground. And health is a state subject completely, and only when the state health department and other departments join hands would such a project of the nature that it has, primary healthcare, secondary care, community engagement, intersectoral coordination can succeed. So I salute your leadership, sir. Karnataka is fortunate in having a young, dynamic doctor as the health minister. I've had the privilege of interacting with sir on multiple occasions, and we share ideas, we share the values, and we share our commitment to work together to take and advance the health sector of our great nation. So I just want to emphasize the importance of this first, and maybe only 2 points I'll make. And I'll come back after the technical session for other discussion. So the importance is that the non-communicable disease conundrum, which you articulated in your speech, is still, we are trying to understand how to tackle it in a health system, the unique health system of India. The developed nations responded to this way back in a different way, but that's not the paradigm that we have to follow, we can follow, and we should follow. We have to develop our own paradigm for addressing non-communicable diseases, including brain health, including mental health, in our own way. And the foundation of addressing this difficult area is primary health care and community engagement and family-centered approach. And that's what is the underpinning of the initiative that we're taking. Primary healthcare focused, appropriate referrals, all connections, continuum of care, sure. But it's about how an individual can maintain positive brain health, positive mental health, positive heart health. We enable that first and foremost, sir. And under the leadership of the Honorable Prime Minister, as you know, sir, very well, prevention and protection, health protection is a prime focus. And it comes articulated in the vision for Ayushman Bharat Health and Wellness Center, which is the platform for comprehensive primary healthcare action and services. And health and wellness centers, and therefore comprehensive primary healthcare, has one outreach for prevention. बीमारी नहीं होनी है, निरोगी समाज प्रधानमंत्री जी ने कहा है, हम निरोगी भारत बनाएंगे, बीमारी ना हो. That's prevention. And here our Ayurveda system, our yoga comes into picture for NCD. That may not apply, let's say, for neonatal mortality. But surely for this huge challenge of NCD, our own systems have a great role to play. Our culture has to play an important role. And of course, the science-driven, evidence-driven protective approaches that we are familiar with, diet, physical activity, avoiding the risk factors such as tobacco. So Nirogi society, sir, and Nirogi brain, equally important. Having said that, sir, then, as you know, sir, as a doctor, we come to secondary prevention. Secondary prevention means बीमारी हो तो जल्दी से पकड़ो, so that it does not advance further. It does not cause damage to the end organs, the other organs, the body systems, and you pay a price. That will mean we detect the illness early. That comes the concept of screening. Timely screening, Sometimes we screen everybody, like for hypertension. Sometimes we screen based on risk factors such as gender or age, say cancer cervix. And sometimes we screen in a slightly different way, as we are doing here in mental health and brain health in particular. So secondary prevention starts by detecting in time through tools that are very sensitive, and based on them we move forward. Thereafter comes the issue of treatment throughout the full diagnosis, shall we say, and then treatment that continues from the facility to home, and the full cycle is taken care of. And of course, in the unfortunate event of a dramatic decline in health, the concept of rehabilitation or palliation would come into big. So we're looking at this paradigm, sir. The underpinning is the primary health care. Now, the importance is the following. Today, the nation does not have a model for primary health care driven, health and wellness centered, enabled, and centered brain health initiative. We have for hypertension, sir. We have diabetes. We have somewhat of a cancer. We don't have it. Now, this is what we are trying to do together. We are pushing the frontier. We are at the cutting edge of public health today. And what we have learned here, you have only learned from 3 districts, you're moving to all the entire state. But from here, it will be a national outreach. We will give this model to our great nation, sir. And that's why the scientific rigor, that's why the scientific advisory groups, that's why, open-ended peer level sharing so that people bring the best ideas into this model and then they can adapt. That's our hope, sir, that under your leadership, this great state of Karnataka, a great institution, NIMHANS, will offer a model for preventive, promotive, and treatment-driven brain health to our nation. But that it doesn't stop there, sir, because the developing world, the LMICs also don't have the model today. We are grappling with it. And therefore, eventually, and soon enough, this will be the model that the world will follow. The World Health Organization will follow. And India has had, sir, the unique distinction, as you're again well aware, sir, offering the world models in primary care driven comprehensive models of care, for example, in tuberculosis, in smallpox, newborn health, and so on and so forth, sir. Even in cardiovascular disease, sir, India was one of the first ones with the early studies in the late 80s and 90s, which paved way for the current NCD program of the world. So what you're doing, sir, is something that the nation will embrace and the globe and world will embrace. So that is the importance, and that's the mission that we are here together for. So I congratulate yourself, sir. I congratulate the team from the Department of Health, congratulate other partner departments, local support, NGOs, and all the team members who have sort of taken part in this as an extra. Leaders have to work harder than those who will follow you. So because we are fashioning the model. So essentially, in this part of my inputs to the group today, I just want to lay down the fact that we are pushing the frontier for our nation and for the world under your leadership. So we look forward to following up on your guidance that you have provided. I'll be here for some more time to hear the deliberations, and we'll be delighted to follow up with my inputs later in the day. And of course, we are connected as a team, and at the right time, sir, we'll be sharing it with the nation soon enough. I think we already have products to be shared with the nation. Thank you very much. Jai Hind.
Can announce that the minister would like to leave for other engagements.
Since the Honorable Minister is busy and he's about to leave for other engagements, we have Dr. Pratima handing over the memento of gratitude to Dr. K. Sudhakar, the Honorable Minister.
I'll come up to the doorstep.
No, please, sir.
Please.
Thank you, sir.
Please announce.
I'll sit here for the rest of the proceedings. Now we have the presentations. So what is next on the agenda? Yeah, so do we go down? Or sir will witness it here?
Yes, sir. You can witness from here on this.
You would like to view it here? Much better. Yes, better. We can come back. Yes.
And then towards the end, we'll come back to the stage. And
Yes, yes. Yeah.
Karnataka Brain Health Initiative update. Now it's just not here. We will resume the deliberations in a few moments. Just open the PowerPoint first.
Ralph Emerson once said, "What lies behind us and what lies before us are tiny matters compared to what lies within us." Moving on, we now have Dr. Suvarna Alladi, the professor and head of Department of Neurology, NIMHANS, and the principal investigator of the Karnataka Brain Health Initiative project, who is going to provide us an update on the key milestones of the Karnataka Brain Health Initiative. Dr. Pratima Murthy, Professor of Psychiatry and Director NIMHANS at the helm of affairs in our institute, with her unconditional support for the Karnataka Brain Health Initiative, has been championing the cause for bringing neurological care closer to the community right up to the grassroots level. May I request you, Madam, to kindly share your reflections on the Karnataka Brain Health Initiative.
Yes, ma'am. Okay. Good morning, everyone. We're always celebrating. So this is one more celebration that I think we all come together for, and particularly after COVID has receded, we are able to all get together and really celebrate today brain health. So since this was called Reflections, what I'm going to do is really reflect on how we reached here and how we go from here. Because this is not a story that started a few months ago. This is the story of NIMHANS, which is now several decades old. I was bringing Dr. Vinod Paul through the campus and telling him about the story. And this is what the campus looks like in February, March. It's usually on the 8th of March. Yes, it's actually around the first week of March. And if you see, the campus is resplendent with these pink trees. And this was because of the careful planning of people like Krundagal, who act, and of course, the Diwan of Mysore, Mirza Ismail, who actually planned these gardens in such a beautiful way. So what I'm trying to emphasize is that planning is very, very critical to make sure that things go well. And particularly when things are done in the community, this is even more critical. Now, again, I told you it's going to be a story of NIMHANS. And for those of you who know Bangalore, you'll recognize the Mysore Bank building, which is still there on Kempegowda Road. And that is where the first mental hospital in the city was actually constructed. And then we moved here, and this is the building of the department, the house is the Department of Psychiatry. What a beautiful stately building. We moved here in the 1930s. A further construction was done above that. And the entire history, for those of you who are interested, is captured in the Heritage Museum, which is the old children's pavilion. So, sir, right in the 1950s, 1960s, we started separate facilities for children, particularly with those with intellectual disability. And that now houses the Heritage Museum. We also have the Brain Museum, which has both specimens of normal brains as well as pathological brains, which you must all get a chance to see when you have some time. In terms of milestones, we have the All India Institute of Mental Health, which was the first postgraduate center in psychiatry and allied disciplines, which was set up in the country. And next year, we're going to be celebrating the platinum jubilee of this particular establishment. You also see the Neuro Center. And at the end of December this year, we start the 50th year of the establishment of the Neuro Center, which was opened by the President, Shri V.V. Giri. Of course, just an illustration of the expansion, the way NIMHANS has expanded in terms of the institutional facilities. We have the Govind Swami block, where several of the facilities are housed. We have a new administrative block coming up. We have a subspecialty block for several subspecialties within neurology and neurosurgery that has been established. This is only an illustrative example. We have several other facilities that have been developed within the central campus of the institution, which is about 135 odd acres. However, we still have to cope with a massive flow of humanity in our emergency situation. And we invariably have about 160 to 180 emergencies coming in when we have facilities only for about 120.
So sadly enough, we do get highlighted in the newspapers for a lack of being able to take everybody who comes in. So this is a great concern for us that we need to establish, we need to help the government of Karnataka to establish adequate facilities nearer them so that everybody need not migrate towards NIMHANS. Unfortunately, this council comes with the reputation and the trust people have in NIMHANS. The fact that a healthcare is very, very expensive outside. So I think we have two important obligations, reasons why we need to develop facilities close to where people are. And what Dr. Paul said this morning about shifting to primary and secondary levels of care, having a continuum of care is music to our ears. So working in the community, again, is not a new issue for NIMHANS. The Sakalvara, which is a southern campus. If you think, sir, this is beautiful, you should come to Sakalvara. It's like a resort. It's just a few kilometers away, and you'll see an aerial view of Sakalvara here. And we have, as you see, done a lot of public awareness about mental illness, about when to seek treatment, about the signs of symptoms, trained medical officers. So there are already models of care for training medical officers and all healthcare providers, including community healthcare workers. And in fact, this has become a model to several states in the country, whether you talk of Gujarat, Odisha, Chhattisgarh, Madhya Pradesh, several of them have taken the models of community care from NIMHANS. We also have the NIMHANS Center for Wellbeing, which Dr. Nagaraja actually resurrected in his time. And there, people with disorders which don't need them to come to NIMHANS, emotional, interpersonal problems, training programs are all held in the Center for Wellbeing. And you'll see a little map of the NIMHANS North Campus, which we hope, which is awaiting sanction by the central government. And this is a 538 polytrauma center. I was explaining to Dr. Paul that one of the deficits that we have here is when there are multiple injuries, we are not able to manage them effectively under one roof. And therefore, we need a continuum of polytrauma care along with rehabilitation, which we hope will occur there. So taking care of the community, all of you are aware that the National Mental Health Program, which was initiated in the 1980s, is now in practically all the districts of the country, more than 700 districts in the country. And that was stimulated by the Bellary model, which was started by NIMHANS as the first district mental health program. And this district mental health program envisages a whole lot of curative activities, school health promotion, mental health promotion activities, IEC, substance use management, stress management, suicide prevention, and adolescent mental health. Again, the reason I'm saying all this is it ought to reverberate in the sense of what we're, kind of going ahead with the KRB initiative. We also have had a human rights perspective to mental health and several initiatives in mental health care improvement, particularly in hospitals, as well as in the community, has been because of a human rights approach to the whole thing. So that's another approach. And our Mental Health Care Act is actually couched in that human rights approach. And of course, the Honorable Health Minister today was mentioning the Telemanas. Again, the Telemanas was in some ways a baby, which was kind of developed after discussions that Dr. Vinod Paul had with Dr. Gangadhar, myself, and the rest of the Niti Aayog team. And now we see that it was launched on October 10th, which was World Mental Health Day. Nearly 10,000 calls have been received. We know the kind of calls that have been received. Every state and union territory now has been supported in actually developing a Telemanas cell, which will receive calls and connect up to the entire services in the country. The Telemanas callers will not know whether they have a psychiatric problem, neurological problem, or a general health problem. And therefore, hopefully, when it gets linked up to eSanjeevani with all the other kind of facilities, with the health and wellness centers, we will actually see that people, whenever they have problems, can get help from the appropriate agencies, both at primary health care, but also equally and in a seamless manner be referred to other facilities, including specialists, very quickly, whether it's a stroke, whether it's a head trauma, whether it's an acute emergency related to violence, acute suicide. These are emergencies that people need to be able to get instant help wherever they are. And of course, before I go to the Karnataka Brain Health Initiative, I must say, Dr. Rajani is here. She has been really pivotal in actually taking a lot of programs in mental health care in Karnataka, in collaboration with NIMHANS, some by themselves, of course, which they should get credit, particularly during the COVID. The kind of counseling that was done by the Karnataka team was exemplary. So these are a whole lot of programs. They expect to extend the mental health program beyond the district to the taluk. They have something called the Mano Chaitanya program or a Super Tuesday program where specialists go to the district to the taluks every week. They have the Manasadara or halfway home care program. They have the Telemanas initiative. They have something called the E-Manas, which is a software to actually, track people as they move through the health system, which again can be adopted. They have assisted home care. So even in the Karnataka Brain Health Initiative, the final objective would be to make sure that people can get continued care in their homes so that when their family member is sick and at home, they don't lose wages. Because that is it's not just a health problem, it's a huge economic problem that people face with any kind of chronic disease. So we need to make sure that's done. Rehabilitative facilities, culture and medicine, dawa and dua. So the mental health care professionals going to places where religious care is offered and actually integrating both these cares. And of course, suicide prevention programs in the urban setting, the Kishore Swabalamban program, looking at adolescent health in a more meaningful manner, and of course, mental health among pregnant women. I added this, Rajini, because I think that's again a very important thing that you have done, incorporating mental health to pregnant women so that they can be in better health as well as their children can be in better health. So there's a whole lot of things that we're working with the government of Karnataka for. And that brings us to how do we now, in some ways, integrate the brain health initiative and neurological disorders into this whole framework. All of us know that there is a huge burden of neurological diseases in the country. Particularly, we heard mentioned this morning about stroke and its relationship with mortality and morbidity, as well as dementia and epilepsy, headache infections, as well as head injuries, also contributing to disability. And there has been a state level disease burden estimation by members of our own team here who have contributed to this very important Lancet article. And as I mentioned, the initiative, which was just a discussion October last year, sir, about a year ago. Now we have come a long way. We've had it launched in January by the Minister of Health and Welfare, Government of Karnataka, and the Chief Minister who announced the Brain Health Initiative in the state budget in March this year. So this was set up as a collaborative program across PHCs, and the formation of brain health clinics at secondary levels, and of course, a seamless engagement with NIMHANS at the tertiary care level. Dr. Suvarna is going to talk about all the details of this particular program and how it's kind of unraveled over the last year. So it'll be very exciting to see what kind of developments have occurred over a year. So as I mentioned, it's in this 3 districts of Kolar, Chikbalapur, and Bangalore South. And it is envisaged that it will be linked with a whole lot of other programs, particularly the maternal and child health program, the NPCDCS program, the National Mental Health program, the elderly care program, as well as the palliative care program. So actually, I think the country looks at developing these horizontal linkages. And so right from the formative time, this kind of linkage is envisaged. And persons with neurological disorders obviously need not just treatment, but a need an improved quality of life with dignity and respect. So looking at integration with PHCs, health and wellness centers, district hospitals, through the brain health clinics, tertiary centers, as well as, of course, community awareness and prevention. And for these, there are very, very common issues across a lot of the chronic disorders. And we also strengthen teleneurology and the digital mental health digital health system. We also continue to do skill accreditation of not just doctors, but also community healthcare workers, including the ASHAs, and to an impact evaluation. And I'm sure Dr. Suvarna will present some of the actual results of this particular initiative. And we also take it as a policy priority. So not only have medical officers, but also doctors been trained in headache recognition and management, epilepsy, stroke, as well as dementia, which are the 4 cardinal areas, of course, along with infections and other disorders. So with the help of the government of Karnataka, these brain health clinics have been established at some of the district hospitals. And these people are in constant touch with the NIMHANS team and getting inputs from them. Of course, we had a very nice event last year where the health minister was there, along with Robin Uttappa, who is the mascot for this particular program, and popularizing the idea of brain health, amongst everybody. So all the patients are being mapped to the PHCs, as well as they're kind of tracked through the journeys that they take. And this will be very important to see how effectively they can manage in primary health care. The team has also started a weekly radio program called the Sumeda Saukya, which tells people, provides them awareness about this whole thing. And in the last World Brain Day, of course, Robin Uttappa being a cricketer, the best way, of course, to celebrate this, his engagement was a cricket display. So Karnataka Brain Health Initiative, as Dr. Vinod Paul mentioned, is in sync with what the WHO has suggested, looking at neurological disorder treatment and, importantly, brain health at all levels of care. And this is something that has been a declaration at the high level of the UN General Assembly. I just wanted to end by saying it cannot end there. If we are to envisage that we are going to provide care and reduce the kind of, the crowds at NIMHANS, we need to develop a hub and spoke model. So as we speak, we've given the government of Karnataka, both through its medical education wing as well as its health service wing, a hub and spoke model where NIMHANS will work as a super hub. And then there will be 5 medical colleges which can work as the hubs where acute intervention for stroke can occur. And once that is done, people can be transferred to step-down centers where rehabilitation can be offered, because that is a big lacuna in not only in our state, but in our country. And as I mentioned, it can be very distressing for families to have to look after people with stroke, with post-head injury, deficits, and therefore we need to do this. Finally, I want to end, since we have 1C of the celebration, I want to end with the theme of convergence. So the WHO has converged mental, neurological, and substance use disorders as one unit. Of course, everyone recognizes that the intervention that need to occur for each of these is very different, but in terms of prevention, in terms of rehabilitation, there are going to be connects which have to be looked at. There is also the World Bank, which talks about mental, neurological, and substance use disorders contributing to about 10%, 1 in 10 global burden of disease. They all have a chronic course. They're very debilitating. They're associated with premature mortality. And of course, they have impacts beyond health in terms of impact on families, in terms of societies, in terms of social and economic capital loss. And therefore, because they've been so systematically neglected, it's important, particularly NMICs, to take these issues of prevention and treatment by governments as well as development agencies. And these walls that we build as specialists need to be kind of at least lowered so that we can see what people need and we can be responsive to the people's needs in the community. And again, echoing what Dr. Paul said in the morning, look at not just mental health promotion. Again, we have the Integrated Center for Yoga and Ayurveda, sir, where we do this very, very effectively. And of course, acute treatment with standard treatment protocols, and then subsequently reintegration and rehabilitation. I just want to say I'm delighted once again that Dr. Vinod Paul is in our midst. He has been such an inspiration to this whole program. And I'm sure with the continued support that Dr. Vinod Paul and the Niti Aayog provide us, the Karnataka government provide us, and the excellent team that is there at NIMHANS, headed by Dr. Suvarna Aladi, Dr. Girish and others for the Karnataka Brain Health Initiative. There are several other colleagues who are doing some minor work in various other aspects of neurology, but I think getting together, working with the health missionary, taking health to the people is going to really become a dream come true. Thank you very much and wish you all the good luck in this initiative. Thank you.
Thank you, ma'am, for your valuable insights on the origin and growth and expansion of NIMHANS and Brain Health Initiative. May I now request Professor Suvarna Aladi to lead the team in sharing the update on the vision, activities, and achievements of Karnataka Brain Health Initiative.
So very good morning to all of you, and really have only gratitude to express to all of you for having come here today, for being friends for the cause. Very grateful. I'd like to start with words that have rung true and they have led us towards growth. This was way back when we saw one of our first few patients with dementia with a very checkered movement towards the hospitals, thinking that it was normal aging, dismissed off by the family as abnormal behavior, reaching a physician and being told to go back because it was part of normal forgetfulness. And then after 4 years, after a lot of damage had been done to her and to her family, reaching us, and then we make a diagnosis, we set in multidisciplinary care. And then the caregiver said, "Is this all you can do, doctor, for us?" So this is something, this was in 2007, that really made us realize that we really have to reach out to more people and create awareness so that they come to us quickly and we can provide the treatment. I represent the entire department of neurology. This is actually their presentation. Each one of the faculty, students, postdoc fellows have worked incessantly for this. I'm deeply grateful to all of you for taking this forward. Then in the Indian Academy of Neurology conference, Dr. Vinod Paul gave the chief case address. And I, sir, if you remember, he actually said, "Cannot neurologists do more?" I've just tempered it down to, "Can neurologists do more?" And that was a call for action that he gave to all neurologists. He met me near the car for 2 minutes, but he remembered. And then he got back to Professor Gangadhar and said, "Start doing something with your department." And so this was another statement that actually rang true for us. Thank you, sir, for everything that you say and do. This is happening just because of you. We need that motivation. You have put a big responsibility on us. It can be overwhelming, but we're actually quite excited. It's something that we do every day. You have told us that you were able to take complex area of neonatology into the community. And this is a story at some point you must tell all of us neurologists. They're all here. They do MEG, they do deep brain stimulation. They've all come out into the community to make this happen. And this was the call for action that you gave in the IAN conference. So thank you. And then we had our Honorable Health Minister in the recent graduation ceremony. He just said, when you want to do something, put your life online and ask. So this gave us the confidence to actually go out there. Otherwise, we like to do our work and expect to be recognized, expect that things will happen, but this is leadership where we really went out and we are asking people to help us, help neurologists and our community to help persons who are living with neurological diseases and to prevent them. So the community has grown. The genesis was with our patients that we saw. The catalysis, the complete support service from you, because as a clinician who has moved into public health, this is the model we want to learn from you and your wonderful team. Welcome to Nishita, Shankar, Sumana, everybody who's here for being with us when there was really nothing. I think Nishita came with us when there was no brain health initiative at that time. She visited us with us, all the health centers, gave us a lot of insight of how Niti Ayog works. So this is where we are. This is when brain health initiative became actually real. And we've heard about the launch by the health minister and then the announcement in the budget. The evening before the budget, we were extremely nervous. We don't know much about how these things work, but Rajini said, if it's announced in the budget, it means something. So, okay, now we know that it was announced in the budget. So we need your help to keep this going so we can do our work and take it forward. But the response from the state government and specifically Sri Randeep sir has been completely supportive. This is your implementation, the 2 words, implementation research, with Dr. Vinod Paul says operational research. It's a nuanced term. We have to learn what the nuanced difference is. But this is Dr. Sir, I'll call you doctor because I keep saying it. Randeep sir, who has been constantly supportive, inspired us and built confidence that the systems actually work. And you represent so many PHC doctors who are here. We have brain health clinic doctors who are here, administrators, superintendents, DHOs, so many people, health mission people who have supported us, and all thanks to Randeep sir, who's helping us do this. So I won't talk much about the initiative. Madam has already given you the basic model. But the challenges were the way the model has developed is by addressing the challenges and finding opportunities within the challenge. So how do we increase community awareness? What really makes people understand? Cricket made people understand. Drumming without speaking, we are able to learn from each other. It's the essential rhythm of the body. So, and then All India Radio, Akashavani, for the channels that most of the channels actually don't even reach the villages. We found out that 90% of the FM channels don't go beyond Bangalore city. So actually targeting the channels that reach the peripheral areas. So these are three main awareness programs, and every primary healthcare doctor now is doing an awareness on for their community, and this is our awareness strategy. Fragmented referral pathways, that's the other we challenge. Most of the neurologists of the department are not here, sir. They're all in the OPD and they have not come, and that's very rightly so, because the numbers are huge. We're seeing hundreds of patients. Many of them don't have to be here, and those that have to reach us first are not able to get us. And this is because of the fragmentation of referral pathway, and your guidance in how to do this is going to be very invaluable. Training of doctors, that was easy because we all trained students, and the PhD doctors were wonderful students. Each one of them was so enthusiastic about learning. Thank you all for getting your certificates and all of that. Drug availability is something I think the doctors will tell us about. We have to get limited acid time in the primary health center, and Dr. Vinod Paul says we have to get it in the health and wellness center also. So this is where these are all challenges, of course, and the need for multidisciplinary care. Professor Pratima Murthy so beautifully mentioned how we need to work together, tear down the walls between each other and work together. And that, madam, is really the endeavor. Thanks for constantly reminding us of that. So that is what the K Abhi is what sir said. So that is what this is going to be about. So I won't go into this, but Dr. Vinod Paul has introduced two challenges, the health and wellness centers and teleneurology. And I can tell you, we have two experts in this field who will talk to us about it. I'm not one of them. So I just want you to meet the team. Our stars are people living with neurological disease. Constantly, we need to remember these are the only people who really matter, and the burden is increasing. So we are constantly focusing on them. Leaders have come together in synchrony, and you have met all of them on the stage. Visions are aligning. The state government's vision, we've heard, is to provide accessible, affordable, and high quality care near doorstep. Niti Ayog's motto is to develop robust systems to inform policy, to guide improvements in population health. And NIMHANS vision is to work with the government for policy planning, monitoring strategies in mental health and neurosciences, and facilitate execution of national health programs. You can see they're all aligned to each other. Saturday is 3 people, but this is the Department of Neurology, and I have to say that many of them are not here, but they are the backbone of this entire program. They have been training, taking care of all. They know the PhD doctors. They take every call. They're solving the problems case by case, patient by patient. So this is a coming together of public health, implementation of programs, and Department of Neurology, which has been led by stalwarts like Professor Nagaraja here. Sir, you should be very happy that we are doing what you have trained us to do. We are doing neurology. Then the multidisciplinary team joined hands. We have the Department of Public Health, the Psychiatric Social Work, and Mental Health Education, who are formally with us now. I've invited the heads of other departments. You know who you are. We want you to join us on this. And this multidisciplinary team in NIMHANS needs all your help, statistics, every psychology. All of you have to be here to take this forward. This is the DMHP team. The success of the mental health program in the districts has actually supported our entry into districts and the IIIT with their experience in the Telemanas, eManas for the Karnataka electronic, the digital system. All colleagues from primary healthcare doctors, Rajini will speak more about them. This is a team. Like, actually, it's not a very resource-intensive model for money, but it's passion-wise, hard work-wise. These are the 10, 15 people on the ground who are the actual ground staff who are keeping it going. They are the pulse line. So thanks, they are the main team that's working, the facilitators, researchers. And then, sir, you asked us to form a scientific advisory group. So this is the people we have. We have Dr. Giridhar Babu from Public Health Foundation, Dr. Guru Raj, who's been the epidemiology lead of the country, Dr. Prashant Mathur from ICMR, Dr. Subhash Kaul, a clinician par excellence, who will be our critic, Dr. Suman Rao, from the who is executing the World Health models for for child health, and I think this is going to be very useful for us. Dr. Sri Kumaran Nair for getting our model right. Jairaj Pandian, who is the president-elect of World Stroke Organization. Yogeshwar, who is actually working in the field with patients, being a neurologist from Stanford, but actually working with people, with tribals. We hope that this group will actually critically review us and develop a model that will stand the rigor of science. So now I'll hand over to Dr. Rajini Parthasarathy to talk about her experiences with working with NIMHANS.
Yeah. Good morning, everybody. So, yeah, you want. This is a true, integrating and active model that we have started. That is our Honorable Health Minister. Actually, we missed Randeep sir here. I think Pratima ma'am was doing wicket keeping, and though she was unwell that day, she had just recovered from COVID, and Randeep sir was actually doing this cameraman's job also. So really active commissioner. We know the vision of Karnataka Brain Health Initiative now, that we don't want any one person with neurological problem go unrecognized, and we want every stroke patient at least to reach our public health institution in the golden hour. And then we actually started our consultations way back, even before our budget speech in December 2021 itself. Maybe the God's grace or some push, and all three of us. First, actually, I had a myth that neurologists can never come to the community. So I keep telling that it's so difficult to talk to the neurologists at NIMHANS, and they are very stressed out. And I was afraid to make a call to neurologists. That myth is also, taken off. The neurologists at NIMHANS, really, very heartening that we went to Health and Wellness Center in Kolar. We went to the Primary Healthcare Center. And then we went to a district hospital. We went as a team to Taluka Hospital, that is block level hospital, to understand what is the community need. So we started actually from the houses. We actually spoke to some household people also, what actually is their need. So we didn't want to start with the top-down approach. So, and then we, in March 11th, 2022, to be precise, so few days before the budget speech, we wanted to understand the perspective of primary healthcare doctors also. And one more challenge was, this was in Chikbalapur district. So we didn't want to call all the medical officers just exclusively for our training purpose. We found out that every month medical officers come for a review meeting, because we didn't want to disturb the community care at the primary care level also. So we went from NIMHANS and Government of Karnataka and Public Health on March 11th for sensitization of medical officers. So we can see Sanjeev Sinha sir, very senior neurologist, who is teaching epilepsy to primary care doctors. Dr. Suvarna taught dementia. We had Priya from psychology, neuropsychology department, who was also teaching them. So this was the first time that our primary care doctors, they said every time in the review meeting, we were asked, we were very disturbed, like, why you have not done, when are you going to do this, when is the timeline? But this is the time, like, today our brains got rejuvenated, and we were asked what should be the model for the neurological, care in the country. So they were very happy. So this is the analysis. Now we have touched and trained 122 primary healthcare doctors across Chikbalapur, Kolar, and Bangalore South. So we can see the clear, how do we say, improvement in terms of their knowledge and the care what they can provide in terms of understanding neurological disorders. So each, like, how are they understanding about headache, epilepsy, dementia, stroke care before our training and after our training. So there is a clear race. And then we have set up what is called as brain health clinics, like models. When if you have time, actually, you can visit our Jayanagar General Hospital. We have our medical superintendent, Dr. Ram Krishnappa from Jayanagar General Hospital, who's been very supportive. Similarly, we have teams across Bangalore South. Primary care doctors have come. Chikballapur also we have doctors, and then Bangalore South also. So I really congratulate all our medical superintendents, primary healthcare doctors also for having joined our hands in this initiative. So we have set up brain health clinics as intermediary stations at the district hospital level. So, sir, very happy to share to Vinod Pal sir that on World Stroke Day, the PHC doctors are teaching CHOs and ASHA how to early recognize the stroke, for example. One simple example, one primary healthcare doctor told that person should stand up and then do this and say namaskara, like speech is all right, weakness of the hand and leg is not there. This is how you can recognize that if there is a weakness. The ASHA could understand so nicely about the weakness, stroke and all. How it was so simplified that our CHOs can understand and our ASHA can understand about the neurological disorders and how fast they can recognize and send the patients to the needy places. So we have also set up telementoring. For example, a primary care doctor gets a child or an adult with epilepsy, she or he gets a confusion. What anti-epileptic can I start? So then they would call our telementoring team.
Developed by NIMHANS and Department of Health and Family Welfare.
So there is a robust connection from Health and Wellness Center, Primary Healthcare Center, secondary level hospitals, and the tertiary level care through the neurologist. So a person at the primary care will get the same care what the person gets in tertiary care, like a premier institute at NIMHANS. So we are, also tied up with collaborating with IIITB to come up with this model. So thanks to Vinod Pal sir. Sir, we have planned a few of these things soon. That is validation of screening questionnaire, and then early diagnosis, timely referral, treatment adherence, brief counseling, home care for disabled, and brain health promotion, which will start from Health and Wellness Centers by sensitizing and training all the CHOs in these 3 districts. And once we get yes from our state government, we will be going ahead expanding this across the state. So now I request our senior neurologist, Pramod Pal sir, to take it forward. Thank you very much.
So COVID was a game changer for all of us, and we all recognized that we could actually connect with people over digital platforms. The movement disorders team has always been at the forefront of doing many things in neurology. And many of us did teleneurology during COVID and maybe some even before. But we are very privileged to have Professor Pramod Pal, Senior Professor at NIMHANS Neurology. He heads the movement disorders team. He was also the past president of the Indian Academy of Neurology. We think that he will share with us how we can do teleneurology forward. This is the other thing that Professor Vinod Pal said. Health and wellness centers reach the primary health care. Then how do we reach it? Teleneurology across all 3 levels of care is what we plan to do now. Dr. Pramod Pal, please give us your insights on this.
Morning. Thank you, Suvarna, for inviting me here. So it is, can I just make it, yeah, I'll just speak briefly on the scope of telemedicine and mainly teleneurology. So first, a few theoretical aspects of this. Now, what is telemedicine? Is the technology for remote exchange of medical information for the purpose of providing medical care. And this can be synchronously, that is in real time, or it can be asynchronously, which I'll show you some examples. And it can be, directly with the patient or provided to provider. It can be a setup can be made. Now, this is a example. You can see here that there are two centers. One is the primary person who is giving the consultation. There is a medical, which in NIMHANS, in the context of NIMHANS, will be a faculty with or without residents, fellows, or general duty medical officers, and others will be helping with nurses, social workers, trained healthcare workers, and administrative staff. And the other side, to whom we are giving the consultation, with the patients, with the caregivers, and the local health professionals, including nurses. Now, there are certain guidelines and certain requirements if you are going to give a tele-neurology consultation, and there will be requirements based on a internet, which we need, an internet, computer, access to high-speed internet, and also to have a nurse or physical therapist at the other end. And it also depends on whether you are providing the teleconsultation at a patient's home level, or you are providing at a certain, like the health centers, if it is established, whether there somebody can be there to give the consultation along with the patient and the caregivers. Now, there are certain several publications are there in the area of teleneurology, and I'm not discussing anything about the stroke, because stroke is well established that at the acute level of stroke, you can have a teleneurology consultation just to detect the stroke, whether the patient has stroke or not, and immediately take the action. But there are a lot of disorders are there, neurological disorders, which are chronic, and you need, after just a first diagnosis, either you need to monitor the treatment, or you just need to counsel the caregivers. So in this era, the patients with cognitive impairment, patients with headache, malignancy, the multiple sclerosis, Parkinson's disease, and other movement disorders, in these areas, it has been found that the teleneurology consultations may be quite robust and may be fruitful. So, and this is one of the, here you can see here the patient and physician satisfaction. Green shows the satisfaction is almost similar, that in the large community studies which has been done in the Western countries, it has shown that there is a significant amount of satisfaction both on the side of the patient, caregiver, as well as the doctors who are giving the teleneurology consultation in these particular neurological disorders, not in the others. Now, what about the teleneurology at NIMHANS? So this actually started mainly, I'm telling you about the neurology, not psychiatry, we're already doing for a long time. But during the COVID time, we had a tremendous problem during the lockdown of reaching out to the patients. So first was the NIMHANS initiative. We started calling back all the patients. So in NIMHANS in neurology, usually we tell the patients to come every 3 months. So there, during the lockdown period, we went to the OPD and we took out all the files which the patient had come 3 months back. We took out the phone numbers, which was about 50% which we could contact. And every day we were contacting the patients from morning to evening and talking with the. Then after a few months, we decided to have a IVRS system where the patient can contact directly with the IVRS, give their phone numbers and give their neuro numbers, which is unique. And we have lakhs and lakhs of medical records with a unique neuro number. We trace out the files, and then we started the initiative of calling back these patients. So this was the one level. Then we also started, especially in my field with movement disorders, where we need to see the patients at least in a real life. So either with a telephonic or with a video. Now, many patients were sending video consultations on a WhatsApp, but we found that a real-time Zoom consultation would have been the best. And we started doing mainly for the patients of Parkinson's disease and dystonia, and it was quite very, very fruitful and very satisfactory to do this. So this is one of the patients where I'm examining, and with my colleague here, Dr. Nitish, and here the patient in the home setting, we are seeing what is the how the patient is walking. This most important thing you need to see in a patient of Parkinson's disease, and also some questions about the patient was having psychosis, and we are just examining here, how the slowness of movement is there or not. So exactly everything which we can do in real life, we were doing on a Zoom virtual platform, and we recorded all these things. There are always the legal issues and etc., which we always explain to the patient beforehand that what we're giving is based only on the teleconsultation.
So it was quite satisfactory, and now still we get the request, and we are again restarting this in a bigger initiative. So just a few slides on, just to show that we need to categorize the patients, especially in the context of NIMHANS, there will be a category A, B, C, D, E. I just revised it like that. So this category, the ideal patient who's has a follow-up at NIMHANS, there's a case record at NIMHANS, their patients are stable, only just need to check the vitals maybe at the patient center, and just a brief history followed by repeat or minor adjustment of the medications, and it can be managed by the local doctors there. Then there are several gradations of whether diagnosis is made or not, whether the patient needs to come back or not. So we can definitely make it into A, 1, 2, 3 categories. And then other categories will be less preferable, like patient was seen at NIMHANS, but only once they came with the state, we do not have any medical records. Then patient was never seen at NIMHANS. So they are the self-initiated, consultation by a person who wants to consult in the teleneurology section. So to conclude that teleneurology can be a very important tool if you want to deliver healthcare or neurology care in the community. And it can evaluate the patients in their own homes, reduce the cost of travel, as well as manpower visit to the hospital. Provide also another important thing, especially cases of dementia and in Parkinson's disease, we need to see their home environment, because domiciliary care, especially in Parkinson's, is very important. So there are freezing of gait, the falls, how the patient, what is the chance of falls in these patients. So that can be very ideal situation. Just you saw in that patient is exposed with a very narrow passage, etc. There's a high chance of fall. So provide cues for the safety and concerns in the barrier in the home environment. This can be achieved by doing some teleneurology consultation. And obviously it can lower the health costs for the government. So thank you very much for the kind attention.
So that was very supportive, Dr. Pramod Paul. Thank you very much. I think we have somebody who has the experience, their team has the experience, and we have guidelines, and we hope that we will be able to do this in the next few months and develop a model, not just for NIMHANS, but for brain health clinics and for the primary healthcare doctors to talk to their CHOs and to people in the community. So very briefly now, what did we actually find in the first 2,000 people with neurological disease in the Brain Health Initiative? The majority of patients are seen by the secondary level hospitals, followed by NIMHANS, and then by the primary healthcare facility. And this is true of all the diseases, whether it's headache or epilepsy or stroke or dementia. This data was collected by the field coordinator. So that is the main resource that we need. Everybody else has been very cooperative. And the records are entered in a live dashboard that is being handled by our research fellows in NIMHANS. What did we learn from headache? It's the disease that has the maximum numbers and disability and least awareness. People just go to take over-the-counter medication without proper treatment. So again, NIMHANS has seen 325 headaches in this period. Brain health clinics have seen 600, and primary healthcare centers have seen only 100, suggesting that patients are actually coming all the way from the villages to us for that one tablet of flunarizine, or for that one tablet of beta blocker or amitriptyline, and for the counseling. Headaches that are primary can actually be treated by the primary healthcare doctors and then done very well on all the evaluation. They follow the headache diary, they're doing the counseling, we're very confident they can treat primary headaches very well. Secondary headaches, this is a protocol that has been developed based on research, evidence, whatever has been published. Dr. Girish Kulkarni and Dr. Pooja have done a lot of work on headache, public health, and based on their inputs, we've developed this protocol. And you can see that the secondary headaches are all being referred. It's just tick, tick, tick. Is there vomiting? Is there a focal deficit? Is there fever? So they're all getting referred to the next level hospitals. But we believe that 682 of these patients could actually be seen in the PHC. They don't have to come. So from 106, we'll need infrastructure to go up to 682. And this is something that they can see very well and reduce the cost of travel and improve quality of care, because they will definitely have more time than here. We just see them in 10 minutes and we are not satisfied with that. So what we want is that this is the current profile, maximum in brain health clinics and NIMHANS, smaller numbers in PHC. With this protocol, we are mapping them back. We hope that majority will be seen in the PHCs, and the secondary headaches that require actual treatment, whether it's a tumor or cortical venous thrombosis, will come for quick treatment to us. For stroke, we had 203 patients. Again, majority were seen in general hospitals, but of them only 9 reached within the golden hour of 4.5 hours. Initially, nobody received thrombolysis, but recently we managed to give thrombolysis for 2 patients. But then we went back and called up each of these patients. So this is Dr. Pooja. I said, do you think they're even coming to us? Or do they think they have a hemiplegia and they're staying at home? She said, no, somebody has hemiplegia, they will go to a doctor. And actually our hypothesis was correct, because when Annie called, everybody, all the researchers called them, 40% actually reached a health facility within the golden hour. So they're going somewhere. It could be a nursing home, it could be an Ayurveda hospital, it could be even a general hospital. And 70% of all strokes reach the hospital within 24 hours. So that is very good news for us, but many of them did not get thrombolysis. And therefore, we believe that there were these 2 patients. One was who received thrombolysis, came from the brain health clinic within the golden hour, Jayanagar General Hospital, Kolar SNR Hospital, and was referred immediately, was thrombolyzed. Another patient who lives in Wilson Garden across NIMHANS got a stroke at home and received thrombolysis. We want this to happen to all the patients, and Madam has spoken about the hub and spoke model, and we will be able to increase awareness. So the emphasis is for awareness and to create stroke ready centers in district hospitals as well. The learning from dementia has been all patients with dementia have come only from urban areas. There has not been a single person with dementia from rural areas who's entered the Brain Health Initiative system. And we know there are thousands of them. Therefore, this is somewhere we need awareness and home-based care eventually. So we're strengthening referral pathways. Mapping each of these 2,000 patients has been mapped to the PHC that they belong to, and they're calling them so that the next follow-up visit. So we hope by March, sir, we'll be able to tell you there was one follow-up visit at least for all patients in the PHCs or now in the health and wellness centers for just continuation of medication, counseling. So this will be the next stage of, they're all mapped. Now we need a first follow-up and a continued follow-up there. And developing a closed loop referral system. As I mentioned, awareness is through something that connects with the community. It cannot be just posters or, so it has to be something that culturally connects. Dr. Vinod Paul said culture is so important, and I think each state is going to have its own version of a star or somebody who connects. And so when we develop the manuals, we're going to develop manuals for each of these activities. How do we do it? So when we go to another state or another district, the manuals are ready for training, the manuals are ready for awareness, so and for the protocol. So it's going to be a question of doing a stakeholder meeting, finding out what is the system in that particular district, how many neurologists, what is happening there. Once we map resources, plug this model in based on what is available there and the need assessment that we will do there. The impact evaluation, again, this is again Dr. Vinod Paul. He said, get everybody into the system, he said, after the first consultative meeting. He said, get each and one of this patient into the system. So increasing service coverage, just take them and bring them into the system. So that will be through the health and wellness centers. And of course, reduction to time of diagnosis, increasing follow-up rate, because we know the second stroke is the most disabling. This is what we've been taught. And they don't take their medicines for second stroke to prevent a second stroke. And just by advising them to take the continued antiplatelet agents, we will be reducing risk of recurrent stroke. Increasing hospitalizations to reduce, quality indicators, and integrate with existing programs for multidisciplinary care. And health and social care benefits, whether it is the certificates for entering trains, whether it's a disability certificate, whether it is a legal issue, we would like, and the government is now doing so many programs, and Sandeep said we would like to integrate with each of those programs that you all are doing, whether it is Ayushman Bharat, whatever it is, we would like the benefits to reach each of the patients that we see. So this is how we think it's a life course disease, early life, midlife, late life, and how through the multiple programs that are going on, even education is so important. Rural development is going to be important. So we'll have to work with beyond medicine to develop a holistic model. And we are very fortunate that the WHO, which has come out with a draft action plan in August 2022, and I think many of my colleagues here wrote the comments on neurology, it's aligning significantly with this. And therefore, when Dr. Tarun Dua came from Geneva to visit us, they are willing to engage with us and again steer us towards something. But for that, we will have to it's always you're as good as the last movie you made, however good you are. So today's compliments are done and dusted for us. We really have to move to the next meeting, and so we can actually do what has been advised to us. I'll end with this short film, and after that, I will request Randeep sir to address us.
India's burden of neurological disease is escalating. Neurological disorders like stroke, epilepsy, dementia, and headaches are the leading cause of death globally. Prevention, early diagnosis, along with accessible specialized treatment can significantly reduce the burden of neurological disorders in the community. To address the challenges and gaps in providing care and services for people with neurological disorders, the World Health Organization developed an intersectoral global action plan on epilepsy and other neurological disorders in consultation with member states. The Karnataka Brain Health Initiative is a novel and innovative healthcare program that has been developed in collaboration between the state of Karnataka and NIMHANS in consultation with Niti Aayog. Launched by Dr. K. Sudhakar, Minister for Health and Family Welfare and Medical Education in January 2022, the pilot project was announced by the Chief Minister of Karnataka, Sri Basavaraj Bommai, in the districts of Kolar, Chikkaballapura, and Bangalore South on the 4th of March. The challenges for reducing the burden of neurological disease in the community are the lack of community awareness, fragmented referral pathways, training of doctors, availability of drugs, and the need for multidisciplinary care. Karnataka Brain Health Initiative addresses all these challenges by a comprehensive strategy. Doctors at the primary healthcare centers have been trained to treat common neurological diseases using a standardized protocol, and coordinators from the Brain Health Initiative are facilitating communications between the PHC, Taluka, and District General Hospitals and NIMHANS, where advanced investigations and rehabilitation is provided to patients with more complex neurological diseases. ASHA workers are trained to screen patients at health and wellness centers and homes for early identification at a personal level. A crucial component will be to ensure continued and referral-based care. Brain health clinics are nodal centers for referral and care and ensure timely treatment for patients with neurological diseases. On a technological level, NIMHANS and IIT Bangalore have collaborated for the digitization through an online platform. The renowned international cricketer Sri Robin Uthappa is the brand ambassador for brain health awareness. Sumedha Saukya, a weekly radio program, is now being aired to create awareness about brain health by reaching out to the most remote areas of Karnataka. The Brain Health Initiative is liaising with the existing national health programs to develop strong intersectoral coordination. The Karnataka Brain Health Initiative exemplifies an effective model of global policy adapted to local contexts and that can be implemented nationwide.
Thank you, Madam, for that comprehensive update of the neurological healthcare system that has been developed by the Karnataka Brain Health Initiative. It is now my privilege to invite Sri Randeep, Commissioner, Health and Family Welfare Services, Government of Karnataka, to kindly address the audience.
Morning to one and all, and thank you for having me here. A very good morning to Professor Vinod K. Paul, Honorable Member, Niti Aayog, our Honorable Minister who has just left us early in view of his engagements, Dr. K. Sudhakar, Honorable Minister for Health, Dr. Pratima Murthy, Director NIMHANS, who has always been welcoming and always ready to associate with all our state programs. Dr. Shankar Narayan Rao, my colleague, Dr. Rajni, Dr. Suvarna, the brain behind Brain Health Initiative, and all the wonderful colleagues who are here, Dr. Indumati, who's here, and all others. Sir, I thank you for firstly being here at this occasion. I was informed that the very concept of Brain Health Initiative arose from a series of discussions that you had and directed us to go ahead. So thank you for choosing Karnataka to pilot this drive, because as a state, we are really lucky to have an national institute like NIMHANS in us, which kind of helped us push with this initiative. I really felt that when Dr. Suvarna, Dr. Rajni, and the others came and explained the concept to me, I found it rather theoretical, and my initial thoughts were, would we really be able to drive this? The PHCs with its own challenges of dealing with primary healthcare itself, and thereafter we have loaded them with mental health awareness and initiatives, and now the third component of brain health. So I was really worried that would a PHC be able to understand the context or the inputs which come from an institute like NIMHANS. But surprisingly, the path was made rather easy, and I was very much pleased to see the way in which the PHC doctors adapted to this initiative, and they kind of owned this as their very own project. They never really saw this as being imposed on them. The Jayanagar hospital, which I have witnessed myself, and the districts, Chikbalapur, the PHCs, the kind of involvement that they are, the doctors who we have interacted with, all of them kind of said that this is a program that for whose time has probably come. And we are at a threshold, sir, where we have also proposed to the Honorable Minister and the government that we really need to look at expanding the scope of, we used to call it KABI, but now you have rechristened it as KABI, probably the Accelerated Brain Health Initiative, or the Affordable or Accessible Brain Health Initiative. So we will look at ABI as an initiative in the state of Karnataka. And we are very happy to share our experience, sir, with the other states where you from Government of India and NITI Aayog would like to pilot this. Or if it becomes a all India program, then I think you should give due credit to NIMHANS and us for that, sir. While you have guided us, the state of Karnataka has been supportive enough, because our Honorable Chief Minister, without batting an eyelid, he immediately announced it in the budget speech, and Dr. Sudhakar also immediately said that this is a project that needs to be implemented in Karnataka, and hopefully soon in the coming budget, we would request the Honorable Government to kind of push this throughout the country. Yes, there would be challenges along the way, but I'm sure with the state being committed and with doctors and support from NIMHANS, we'll be able to drive this ahead. I thank the entire team which has supported this, and Professor Paul can now probably guide us how we can take this initiative ahead. And any kind of shortcomings that you have seen, sir, please feel free to share that with us so that we can improve it in the coming days. Thank you again for this opportunity.
Thank you, sir, for generously sharing your time and experience, and we look forward to your continued support and your esteemed leadership for taking forward the Karnataka Brain Health Initiative. Now, may I once again request Professor Pratima Murthy, Director, NIMHANS, Professor B.S. Shankar Narayan Rao, Registrar, NIMHANS, to accompany Professor Vinod K. Paul, the Honorable Member of NITI Aayog, Government of Karnataka, and Shri Randeep, Commissioner, Health and Family Welfare Services, Government of Karnataka, onto the dais.
Yeah,
Thank you. It is once again my pleasure to invite Professor Vinod Paul to address the audience. Dr. Vinod Paul is a brilliant pediatrician and a neonatologist. We want to We want to share with the audience that he's the editor of Guy Essential Pediatrics, which has been the Bible for us from our MBBS days. And he has been instrumental in conceptualizing the Ayushman Bharat program and the Poshan Abhiyan, which is running very successfully. It's a great privilege to have you with us, sir. May I kindly request you to address us?
Hello. 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 Thank you very much. Shri Randeep, Dr. Pratibha Murthy, Registrar, distinguished colleagues. In this segment, what I would like to do to start with is to take feedback from the team that has come here to listen, but also to share your ideas. तो मैं चाहूंगा कि जो इन्वॉल्व रहे हैं इसमें, स्वर्णा, कैन यू हेल्प अस टू दैट? पिक अप अ चेयर, थोड़ा सा इंटरेक्शन करवाइए। आप बताइए यहाँ कौन कौन है? हाँ, तो रेज हैंड करेंगे, अपने आप को इंट्रोड्यूस करेंगे। सो वी बिगिन नाउ। टेल मी, वी हैव द पीएससी डॉक्टर्स।
Clinic doctors, Devendra Paise.
जी जी,
He left.
कोई नहीं,
So we have the PHC doctors.
पीएससी डॉक्टर, मेडिकल ओके ओके ओके। आप सीनियर हैं, आप थोड़ी देर में बोलेंगे, पहले हम इधर से शुरुआत करेंगे। सो लेट्स हैव रिफ्लेक्शंस on your experience. थोड़ा बताइए और सुझाव भी दीजिए।
Good morning to all the dignitaries and all the colleagues, friends who are all seated down here. So what shall I tell? I think it was a God-given opportunity for us to be associated with NIMHANS. I think all my colleagues would agree that, if we were along, we would have been loved to be in NIMHANS at some point of time. But yeah, we are here in our own PHCs or wherever we are doing work. We want to give our best care to the people who are seeing us. So if NIMHANS is directly guiding us, who would say no, sir? I think a big clap for all the NIMHANS team and for all our team right from Government of India, including you, sir, who guided us to this level. Say from Government of India, Government of Karnataka, NIMHANS, and to us. So I think everybody has done their job well for us to get guidance from NIMHANS so that the patients we see at the ground level, they get good care. So I think I'll be very happy. I just recognized Rishita ma'am there. Hello, ma'am. So madam has visited us. Yes, sir. As madam told, many people, there are less in number, so I've reached to PHCs with headaches, but I can share a couple of stories, successful stories. So a couple of days back, I had treated a lady with migraine who we had a follow-up. She had come to us for a follow-up. It's been her 3rd month and she's very happy. So she was like, madam, how long should I continue the treatment? I told her, as we have been guided in the protocol, I explained to her. And she's very happy. So she's got good care at our primary health center level, and I'm very happy about that. So at our own level, if we can treat patients with the same quality of care at the tertiary level, I think we have done our work well, best, and we can have a good day. We can have good sleep at our night. So at the same time, whatever quality of care we give to our patients, the same continues at all level, be it our friends, colleagues, or whatever it is. What we practice is what we see in our day-to-day life also. So be it any level, maybe at a family level or at a public level, what we practice only we take home. So I think we must all strive our best to give good quality of care. I seek continued guidance from NIMHANS, madam. Yes. So recently I was telling I have treated a migraine case successfully. Now I saw a cluster headache case. So I gave the input that we need a protocol for cluster headache also. So that is the continuum of education or continued medical education I am seeking. And I'm sure all my friends here also would agree. So at least if we start getting cases day by day, one at least will gain the confidence to treat more people. So thank you so much. Thank you all. Thank you, everybody.
Thank you very much. Thank you. Thank you. अभी और सुनना है हमें.
So I think our neurologist, sir, from NIMHANS.
No neurologist. No neurologist. Our PSC team. Primary care team. Primary care.
Yeah, primary care.
Yes. आप कौन से जिले से हैं मैम? बैंगलोर साउथ. तो दूसरा जिला कौन है हमारा? चलो वहां से बोलिए.
चिकबल्लापुर.
PHC डॉक्टर यार इधर.
PSC डॉक्टर किसने भी इन्वॉल्वमेंट किया है. CHO PSC डॉक्टर आपके जिले से एक चाहिए मुझे इनपुट.
Good morning, everybody. So I'm happy to
introduce
be
yourself. Introduce.
आप अगर सुझाव भी दे सकते हैं. Appreciation तो बहुत हो गई.
I'm Dr. Narayan Swami, working as a medical officer in Primary Health Center, Dargamohalla, Kolar. So before this Brain Health Initiative training, so we come across many patients with dementia, headache, stroke. So immediately any of these patients comes, so the NIMHANS the first to come in our mind. So after the this brain health initiation, so we have come across many brain health patients with headache, dementia, stroke. So we have whatever the protocol we have learned in the training, so we were able to manage. We have managed many cases recently, and we directly contacted the NIMHANS faculty also. So we have clarified some of the treatment protocols, and we could able to manage. And so we assure on behalf of all the doctors, so we will definitely minimize the burden of NIMHANS, so that these kind of patients we manage that periphery. So the burden of NIMHANS will come down, and quality services we can give at periphery also. Thank you.
Thank you. And the third district, Suvarna ji? तीसरा जिला?
चिकबल्लापुर.
चिकबल्लापुर ही का है.
Okay.
चिकबल्ला. इवरो कोलार.
यार कोलार.
कोलार. चिकबल्लापुर.
कोलार की टीम कहाँ है? Please.
He is कोलार.
कोलार हो गए. तो
चिकबल्लापुर.
चिकबल्लापुर की टीम हाथ खड़ा करें.
There he is standing.
Yes.
Morning, everyone. Myself, Dr. Suresh from PHC Builder, working as a Chikballapur. Sir, after the training session from the NIMHANS, we have been very well trained about epilepsy in pregnancies, dealing with the epileptic cases, and absent seizures in children. We have been very confident in diagnosing the case and giving the initial treatments. And I request the state government for more equipments, so that it will be helpful for the timely diagnosis. And as Suvarna ma'am told, the dementia cases have been not referred from the PHCs. Ma'am, we are able to identify the cases, but we are unable to refer them because of the we are not able to receive the support from the family side as well. So I request we need more IEC for that as well.
So this is how it's growing, sir. Each time we're identifying a problem, and then when we address the problem, that is becoming a part of our protocol. And they are quite unhesitant in giving us feedback, which is what we want. Yeah.
Elaborate on the equipment.
Yeah, what kind of help do you need?
Ma'am, we are having a CT scan at the district hospital, sir, and it will be helpful for we have an MRI for timely diagnosis and treatment. And at the PHC levels, we are not having any sufficient drugs for the mental health. And for us at the PHC, we are burdened with these cases, and shortage of the staff is a problem for us as well. So we request the Honorable Commissioner sir and provide the required HR so that it will be helpful for us to do the necessary services to the public.
Okay, good.
Thank you,
Good,
sir.
excellent. Okay.
Okay, can we just have all the PHC medical officers raise your hands and see how many of y'all have come, and a big shout out to all of you.
So I think one input I like to have from this side, यहाँ जो है वहां से बोल सकते हैं, किसी भी जिले से हो. Okay, please speak.
Good morning, sir. Sir, I have been treating all
Can you
the.
introduce yourself?
Sir, I am Krishna, sir. I am Dr. Krishna from Nayanali PHC, Chikbulapuram, sir. We have been treating all mental health patients even before this one, sir. But after starting this one, starting this Karnataka Brain Health Initiative, we have got all the knowledge and also support from NIMHANS people. Now we have started all coordinator. He is coming time to time and he is giving suggestions also, so that we can give his support and also time to time knowledge also, sir. So in future also we can give good treatment and all to the public, sir. Thank you, sir.
Thank you so much.
So he's brought in the importance of the coordinators, sir.
Please.
Good morning to all. Myself, Dr. Ramakrishnappa. I am the medical superintendent of Jayanagar General Hospital, sir. Actually, I joined the government service in 1991. It's now 32 years. The early days of our service, it was very difficult to treat cases of this kind. The only treating center was NIMHANS. Even at the district level, it was not properly handled. Today, this kind of network we have created in the brain health is really good, and it should be very well adapted, and it's really helpful to the patients who are in the outreach, sir, especially in the villages. And in our hospital, we have treated 360 patients from August 1st to December 3. In this, 271 headaches, epilepsy 33, strokes 35, dementia 23. So in association with our NIMHANS, we have treated all the cases. We have a good team of doctors in our hospital. We have very good physicians. And the NIMHANS is really supportive to us. Thank you.
I must mention here, sir, even before this became a reality, we had no brain health initiative. I used to go on a Friday and they were in dusty room. They allowed us to sit there and just look at what was happening. It was completely informal, but sir just said, do it. We want to do it, because very difficult to get physicians to actually engage with us. So all his Department of Medicine has been so supportive, each one of them, and in adopting the protocols. So thank you.
Thank you. We have distinguished members of the scientific advisory group here. So Prashant and then Suman.
They are just introduced
Prashant,
to this
your
today.
views?
Thank you. Yeah, Mike.
Good morning, everybody. Thank you for including me into this great initiative. And I do see a lot of syncing with other non-communicable diseases initiatives. And how do we align this so that it improves the overall health also? Brain health, mental health has been neglected for many decades, even at the global level. People don't consider it as part of NCDs. And now getting into the intervention mode will bring a great kind. I mean, even comorbidities, if you look at diabetes prevention and other hypertensive diseases, cancers, I think this will be a big way, and capacity building is something which is a tremendous need, and that I think I do look forward to learning from this initiative and giving the best contribution which I can from my experience.
Thank you very much. And not you, but Aislima.
Yes.
As well. Suman? Thank you.
I'm really honored to be part of these esteemed group, and as you said, I've got introduced to this day, and I see two main things. I think particularly super specialists should come out of their ivory towers and work at the grassroots level. And that not only takes, like you all said, the care, tertiary care to the PHC level, but I think it's a two-way learning process. We have been doing this in newborn health, and I think we are inculcating a very good model for our students, your DM residents, the whole team, and that I think would go a long way in connecting the tertiary to the PHC level. That's one thing. And I was sitting and looking at first, I told sir, I don't know what I'm doing here because I'm a neonatologist. But I think this, when you look at brain health initiative, and it's across the spectrum. I can see myself looking at how from a newborn, a child, we can contribute and look at preventive and promoting brain health in this. So thank you and all the best to this.
Thank you. Thank you, Suman. There'll be
So there are some
things you'll have to work on. So it's just the beginning. We have an agenda for you.
So
Dr. Indumati, ma'am, please, your reflections, your guidance, your sujav.
Sir, what I request is the same can be given to the schools, sir, where before their exams, if we can give them the confidence that whatever percentage or whatever the stress they are undergoing during the examination, the aftermath of the examination results can be taken. And during our PMSMA, where we are doing every 9th of this month, where we are treating the pregnant, diagnosing the pregnant ladies. So that time also this Mano Chaitanya, what we are doing, there also the postpartum depression, which we are seeing in the delivered ladies can become. This is my two requests, sir.
Thank you, ma'am. Sir, would you like to say anything, sir?
Yeah, good morning, sir. I would like to share my experience as a medical officer at the PHU when I started this journey from Bangalore Medical College when I passed out in 1987, and then I went into a PHU, sir. I would like to just one incident which still today, till today, it is very much in my memory, is that there was a patient with epilepsy. She was around 22 years. During cooking, her hand had fallen into the stove. And then after 2 days, she developed tetanus. Then I told her father, she did not have a mother. I told her father, you will have to take her to the epidemic disease hospital. Then he asked one question, sir, what happens if I don't take her? Then I told her, definitely she is going to die. Then the next words, what the father told me is still, it is very much green in my mind. He told, is it, sir? I am very happy. I will not be taking her. Let her die, sir. I became so angry. At that time, I was from Bangalore, and then I went to the rural area, and the father was telling, and he was letting the daughter who was around 22 to 23-year-old die. Then I became so angry, and then I started scolding him. Then he told, sir, do you know what life is? So I am 60-year-old now, and no one is willing to marry my daughter. What happens after my death? No one is there to take care of my daughter. At least if she dies in front of me, then I'll be able to die peacefully. So it was a great lesson in life for me. At that time, NIMHANS had only 2 seats of DM neurology, sir. One was for general and one was for the reservation. And then I took it as a challenge. Then we had a very good clinician, sir, in Victoria hospitals, our professors. We were able to diagnose. Then I personally went, bought Harrison's, started reading about treatment of epilepsy. Then I took it up as a challenge not to refer even a single case of epilepsy outside, and most of those cases I was able to treat during my time, sir. From that time, from that elitist time, now later on, now today, cut forward today, we have seen. I am really happy that NIMHANS is taking up this initiative so that we are able to reach the community and all of us. Ultimately, it is not what knowledge we get, but what the community, how it benefits from our knowledge, sir. I think it's a very great initiative, and I thank you all, sir. Thank you.
So we have our other SAG members, sir. Dr. Srikumar, Dr. Yogesh, can we ask him to speak, sir?
Please.
Yes,
Okay.
hi, good afternoon, everyone. Can you hear me?
Yeah, we can.
Yeah, wonderful. So it's just great to be there. I wish I could come there, but couldn't come because of some other scheduled appointments. But first of all, let me congratulate NIMHANS, Dr. Suvarna, on this initiative, and Dr. Paul's significant contribution to it. Having trained as a neurologist and working as a faculty in neurology in Baylor, and then subsequently working for 10 years in rural and tribal regions of Gadchiroli, and now 1 year in northern rural and tribal regions of Chhattisgarh, I have seen how there is a huge need for specialty inputs into our public health systems. And currently, I am working with 2 district hospitals to improve care of epilepsy in these 2 district hospitals. There are 3 things that I would like to highlight. The first thing is that there is huge thirst that I found in terms of learning in these medical officers. I mean, they have to deal with the unfinished agenda of maternal child health, but there is immense desire to learn new things, and we don't have a systematic mechanism of giving them inputs. One of the feedback that I get from medical officers is that at district hospitals, we don't have any CME-like activities. So it is important that our academia reaches out to district hospitals and help build their capacity. B, which is already highlighted in the program, is using protocolization of care to simplify. I mean, having worked at both a neurologist as well as a primary care provider, I feel that 70 to 80% of the care can be simplified using protocols, and bringing in a cultural change of using protocols into public health system. So that was the second point. And third thing is, inputs such as these help the doctors reimagine care. I mean, I work at one of the district hospitals, and they have started cancer care, and that medical was proudly telling that, sir, now I can manage cancer patients to some extent here. So on all these 3 accounts, I think this brain health initiative would be a really, really wonderful initiative in terms of building capacity of our public health system. And eventually, once people start seeing benefit, people will come and seek care. Right now, one of the challenges that we have is this very negative perception about public health system that people have. And once services are, have become available, we have seen that people start getting care. So again, thank you very much for this wonderful opportunity to be part of the scientific advisory group here, and a wonderful brain health initiative. Thank you.
Thank you.
Dr. Srikumar. Dr. Srikumar.
Yes, thank you, madam. Thank you. Thank you for getting me into the advisory board. It is, first of all, congratulations to the NIMHANS team and the government of Karnataka to getting into such a wonderful initiative. I am Dr. Srikumar. I am from I'm professor of biostatistics at JIPMER Pondicherry. So with that, that I more work with the data, and I wanted to believe things based on the data. So probably it is a great initiative, and we will see that based on this this initiative, what additional things data will produce, and then evidence, and finally policy. There could be some change or an evaluation of policy. All those things can happen. So nothing more I want to talk. But it is a great initiative, and the support of I know Professor Vinod Paul and Niti Aayog and Government of Karnataka. I think it's will be able to do a wonderful job. And I think end of it, I mean, in the middle of it, it's we get some data points to even reevaluate the policies. Thank you very much from my side, and I will support whichever way I can get in terms of modeling or any other way from my side. Thank you very much.
Thank you very much. Thank you, members of the SAG.
Anybody else is there?
So we will move toward conclusion.
Okay. Well, I will
Okay.
contact. I think that's fine.
Okay.
Girish. Dr. Nagaraj. Okay. Right. We can stop.
Okay. Thank you to be back again, and thank you for inputs. बहुत अच्छा आपने बोला. So let me, in conclusion, highlight a few thoughts, few things that I like to emphasize, and by way of Randeep, the way forward. सबने मिलके आगे किस तरफ जाना है. Now, first and foremost, you saw wonderful slides. Lecture is not one of the best way of teaching, by the way. So let me test the capability, effectiveness of the lecture. मैडम ने एक स्लाइड दिखाई थी, WHO रेजोल्यूशन दिखाया था, उसके ऊपर डेट क्या था? Raise hands who have the answers. तो मैं तो जॉब दे चुका हूं मैं प्रशांत. I gave him the first job, no? So एक स्लाइड दिखाया गया. There was a slide shown by ma'am, and I think Suvarna ji, you repeated that, on which there is a WHO resolution and there was a date. Date. Yes. No? आपसे तो पूछ नहीं रहे, आपको तो टेस्ट कर रहा हूँ, your teaching skills. What? 22 तो अभी भी चला हो. April. So who will give the chocolate box to her? She cracked it. So April 2022 is when WHO thought about brain health as a resolution. Not that they've not been thinking, but in the form of a resolution, in the form of giving a call to work. When did we start KAB? Okay. And in April, the government of Karnataka has already given the budget. So that's India's leadership. That's India's leadership. So be ahead. Okay, you are going to lead it. वो तो resolution बना रहे हैं. You have a project already running, showing effects, getting into implementation research mode, operation research mode. Inputs are coming, experience is coming, the training is over. We're already talking about expanding into entire state. And you know what is the size of the state? Population of Karnataka? Raise hands. Jaldi bolo. Fastest finger first. What is the population of UK? 6.8 crore. So you are saying पूरे एक बड़े देश के बराबर की population पे हम already scale up की बात कर रहे हैं. So we should be proud that you are thinking ahead of time. We should be proud that you have a, I would say, articulation of the model. The final model will appear after our much hard work. Some points I will make. Some points will come from SAC. Some points will come from peer review. So first we'll give a big hand to Government of Karnataka. Well, thank you so much. And see, I look forward to meeting the Honorable Chief Minister this afternoon, and I will convey the pioneer work that this team has done. And now we'll give a big hand to NIMHANS for obvious reasons. Okay. So we're going to create history in 2 years' time, and there'll be this model will be the national model. on that primary healthcare platform that I was talking about. Never forget that, because that's where this will get embedded. Otherwise, it is not compatible with the policy and the paradigm that's unfolding in the country. Don't have programs which are disjointed the way health system is developing. And here we have a perfect synergy, but some more work needs to be done. Having said that, let me now give my reflections, some in brief and some my team should take notes because we have to follow up on them, please. Everybody should take notes, whoever is concerned with. Oh, by the way, I must also have one more applause for the National Tele Mental Health Program. What started NIMHANS, and then we were fortunate that we worked together and take it forward. It's already a program. So you already delivered a program. Congratulations. 22 has been a special year for you. So firstly, I like us to remember that we will have strong linkages, as you ma'am said, NPCDCS program and DMHP program and other programs. I like to see this being articulated conceptually, in writing, in thinking, in capacity, in inputs, and indicators, in output. उसके साथ alignment करना है. A lot of it is background work. Front end looks very simple. You don't have to confuse audience of this nature about that. But then it has to be embedded with that, and we will like to see then connect how when it operates seamlessly with the mental health side. I like us to, they're not in a particular order, okay, because they're the way the thoughts came, so I've been writing. The things that you already have got right in a big way, I'm not counting everything, but I think what I have felt that the government and NIMHANS, you got right the community, shall we say, awareness, correct, okay, more than what I expected, the awareness part. So your engagement with the way you're reaching out to community, you're talking, the radio, you've already gone one step further. So I think you truly got it right. And I like the principle that Randeep, your team is saying bottom up rather than top down. So you really got it right. And here you've crossed my personal expectations because I would have thought of it to tell you later, but you did it upfront. So congratulations. Your capacity, you got it right already, but we'll have to do more capacity. I'll come to that in a minute. I think the neurology, you have already done good work, that wonderful presentation. Please compliment Professor Saab. Please do convey, he's working in the outpatient, I'm sure, so please do convey. But I like to see the connect with this paradigm getting sharpened, because that is a tertiary superstar neurologist talking. It's a very different thing when it is to be talked by a CHO to a PSC doctor or a district specialist or a medical college specialist. So we'll have to adapt, but I think the strong thinking is there on this campus. You're also getting right the hub and spoke model very well. Your thought, your leadership in this visible. And so hub spoke thinking will help us, the government of Karnataka, to plan out much better, because that's how this will work and this will be then moving forward. Okay, right. Now, two or three things which I think we should now talk about. One is, you remember the public health paradigm I gave in the morning, I said primary prevention. So now, can we think about positive brain and mental health together? Okay. Prashant thinks about positive heart health, ICMR, taking forward hypertension in a big way. Can we now expand positive? What is it that we should do for positive brain health, right? It may be about music, it may be about yoga, it may be about meditation, it may be about talking, it may be about better sleep. I don't know. Sleep. I didn't hear that word. Sleep, positive. So isko sochna shuru kar. Create a paradigm of promoting healthy brain health. Okay, a positive brain health. Start thinking about it. You have it? But where is it? Where is the package? Posters are one thing, but what are the elements in that? You got it? Okay, sleep.
Exercise.
Very good. So you got it. Thank you. So great people think alike. I said almost the same thing. She knew more than this. So kindly promote. Now the issue is, you get a consensus around it. So tomorrow somebody not say, hey, to reh gaya. What is the evidence? So bring that element, because tomorrow we have to sell it as an evidence-based approach, not as a ideology-driven approach. That I believe good sleep is good. What do we mean by it? Right? So sochna shuru karo. So this will be a wonderful contribution again from India. The second part is that I don't think we should delay too much to include the pediatric component to brain health. The growing brain is even more important, come to think of. We are on the other hand, which is fine, On this end also, positive things have been thought about, some things have been done. ICDS program in a way, family care center, parenting, nurture care. But I think we will not overload this because we are moving in a certain direction. But then as we are thinking through this, when we offer the model, perhaps if it is from the beginning pediatric component, it will help. It doesn't have to be, because we are delivering something very critical. I don't want to derail at all or overload it, but start thinking about it. Okay, and that's where Suman, your role can come. I also like to extend that a little bit to tell us that, and that's my, I would say, what should we say? Review, not review, but critique. Okay, critique. There has been an emphasis on detecting abnormality, but less emphasis on promoting positive. One positive was this part, but the other positive part is, childhood development, nurturing care, enhancing connection building in the earliest phase of life, up to 2 years to 3 years, particularly 6 months to 1.5 years, particularly. So that positive side should also be, so what you may call it early childhood development, to be somewhere to be thought about. Again, not necessarily as this initiative, or possibly also as part of this initiative, but remember, that is very important. Our national education policy has emphasis on similar kind from 3 to 6, but the 0 to 3 is missing. I like us to see if there is a way of balancing it out without overloading. Is there a way, my next point, that stroke management can be thought about without CT scan? That's a big one. The answer is no as of today, but can there be technology which distinguishes hemorrhagic from non-hemorrhagic? What kind of technology could that be? What is on the horizon? What is on the horizon? Because if there is something that can come up, we can take lead now before somebody else makes those machines or sensor. We can have our startup culture and IT culture to start thinking about it today. Otherwise, you have to import, and if you do it together, you will export. So start thinking about non-invasive ways, or ambulance en route way to guide telestroke kind of initiatives. Because I think it simply becomes too late, technically speaking. There must be another way. There should be another way. If ECG can detect, and ST elevation, and that can be an entry point for heart, can there be similar something? Can there be and some other sensor? Socho uske bare mein, that's a different track, but because it came up, I'm just saying, why do we have to have Philips or GE having produced this rather than not being produced here next door? Let's think about that. I like us to think about systematically extending the training for particularly CHO, ASHA. Now, ASHA training doesn't have to be 100 pages of essential pediatrics. It has to be a page. Okay, the tool that she'll use is a page. CHO will have maybe 5 pages. IMNCI type of approach. So I alerted you to that. So start working on it. Ask 5 questions, see this one, and so on. So please start thinking, how many are those? वो कितने हैं? कितनों को train करना पड़ेगा? कैसे पूरा होगा? How do we engage the medical college in that hub and spoke? You must engage them. They tend to get left out, particularly because the governance structures are sometimes such and they're supposed to be busy. No way. So kindly engage them. They have to be part of the topography that you will develop. They cannot be left out. CHO would be in a position to prescribe drug with the consultation with a doctor and follow up on the drug, and then follow up, because these are long-standing treatments, on the compliance and continuity. So think about that role. Really think about the holistic way of saying health and wellness center paradigm for this. Toward the end, ensuring drug supply will be very important to build the confidence. I'm sure we are fine with that. I think I'm done. That's between us. Yeah, that's really what I think I have noted down. Yeah, the last point is that, someone said that, and I want to endorse it completely. Brain health will be guided, developed, taught by super specialists, but will be delivered by non-specialists. Bring it down, bring it down, bring it down, bring it down. Don't take it up. And that's the example that comes from newborn. Someday we'll tell you, we could have gone the other direction. No, bring it down. Then only it goes close to people. There is a role. I'll give you an example in child health. The diarrheal disease, in some sense, somebody could have said way back, it was pre-pediatrician ko karna hai. But today, the prescription I write for diarrhea is the same that Asha writes. 4 points. ORS, zinc, continue feeding, danger sign. Period. I don't write anything for in my prescription. So it can be simplified, right? And then there's another level. There is a malabsorption, there is a celiac that follows, but don't start from there. So get to the core. So जो प्रदीप भी कह रहे थे, जैसे और मंत्री जी कह के गए, उस तरह से सोचना शुरू करिए. कोर वही है, उसके अनदर लेयर आती है, उसके ऊपर एक और ये पहली ही कोर में 80% कवर हो जाता है. तो वो तो देना है हमने. हाँ, one other point was to connect the referral pathways to PMJ and how they get passed. Please also give us ideas about referral system in terms of ambulance referral and emergency care. This is connecting your intervention to health system, because emergency care departments are coming up in all medical colleges in the next 1 year or so. They'll all have to develop. You're aware that NMC requirement. So how do you then latch it on to the emergency departments? How do you alert them? What is the training for the emergency casualty colleagues for this? So there's another set of training to be done. वहाँ जो बैठे हैं nurse, वहाँ जो doctor बैठे हैं, उसको लिए क्या होगा? तो यहाँ तक ही नहीं खत्म होती, उधर जो बैठे हैं, तो so that there is no third delay, that they act. What is it that we can do en route in the ambulance? Start thinking about that. So I'll stop here. These are ideas random as they appear. The whole I think the narrative that I am trying to convey at this point in time, that's very major and very speedy progress on this wonderful, innovative, cutting edge, game changing, frontier pushing initiative. But we still have to build along the health system, go close to the people, bring in the scientific rigor of measurement, not for making it difficult to implement, but to ensure that we can communicate that in the language of science to the people. So with these words, my gratitude to the government of Karnataka and to NIMHANS leadership for this opportunity. Thank you very much.
Thank you, sir, for sharing your expertise on capacity building and efficient delivery of public healthcare services at the primary, secondary, and tertiary levels. We look forward to your continued handholding and support for the success of Karnataka Brain Health Initiative. We now move on to the launch of Healthcare Access and Innovation Laboratory website. This initiative is being supported by Sri N.G. Vishwanath Foundation, instituted in the honor of his maternal uncle by Dr. Amrutakar Anil Kumar, who's a professor in the Vanderbilt University at the United States of America. May I request the dignitaries to kindly inaugurate the launch of Healthcare Access and Innovation Laboratory HAIL website.
Those are the drums.
Sir, we have with us Mr. Professor Nanjundaswamy, who is retired professor of pharmacology, who is the brother of Professor Nanjangod Vishwanath. He's come here, sir. I would like to request you to come on stage and hand over the MOU to our director, and also a check of 27 lakh rupees as part of the phase 1 to the director.
Thank you very much for your very generous contribution. Thank you so much. I appreciate it.
I'm extremely thankful for this opportunity extended to me to be present here on this August occasion. Enabling me to remember my brother, by participating in the inauguration of healthcare access and innovation laboratory at NIMHANS through NG Vishwanath Foundation. Mr. NG Vishwanath was joined. Himself so much caring for his friends. And this in the short tenure of life, healthcare access innovation laboratory is a great opportunity for us to contribute to the society of initiative and request in success, and also that we can contribute to support to this. Thank you. We would like to remember and recollect the extensive contribution and facilitation by Professor D. Nagaraja for this initiative. I'd like to request sir to come on stage for a group photograph. Can we have this HAIL PPT mantra?
As we come to the end of today's program, may I request Dr. B. A. Shankar Narayan Rao, Professor of Neurophysiology and Registrar NIMHANS, to kindly propose the vote of thanks.
Very good afternoon. It's a momentous occasion to the NIMHANS and also to the government of Karnataka, and more importantly from the Niti Aayog. So we have Professor Vinod Paul. So for envisaging the whole program and also mentoring and also guiding at the multiple stages, which culminated into this wonderful program of government of Karnataka and headed by NIMHANS, which has now moved very much ahead as it was planned. And more importantly, whatever the mentorship and also the government of Karnataka and Niti Aayog support, what is more critical in this program is our PHC doctors. Our medical officers, they are the key people to implement the entire program. I think the 3 districts, each one of them, they participated, and they started relearning their medical profession in association with NIMHANS. I'm very sure that the needy patients, they get a support in the PHCs. So both at the taluk level and district level and at the village level. So you have the support system. So that is the main objective of the Honorable Prime Minister, that healthcare should reach to the needy persons. So on behalf of NIMHANS, we take this opportunity to thank Professor Vinod Palji for supporting this entire initiative. As he has mentioned that this initiative is going to be a national initiative and subsequently it's going to be translating into a global initiative. So for that, Government of Karnataka and NIMHANS will be part of the global initiative. On behalf of NIMHANS, we thank you for the entire support which you have offered. And I request our director, Dr. Pratima Murthy, to felicitate you with a small memento from NIMHANS. So on behalf of NIMHANS and Government of Karnataka, we take this opportunity to thank our very dynamic, the Health Minister Sudhakarji. He is always part of several initiatives, and NIMHANS and Government of Karnataka, we work very closely in several the programs. And as Madam was mentioning, the Bellary model has translated into a national mental health policy of the entire country. And this brain health initiative model is going to be a model for the entire country. And on behalf of each one of you, I take this opportunity to thank our Honorable Minister and the entire team of the Government of Karnataka, headed by Randeep sir. And the entire team is here, most of them are here. And so for the lack of time, I am not able to each one of them to thank. And I'll thank each one of them. On behalf of NIMHANS, I take this opportunity to thank and hand over a small memento to Randeep. And more importantly, the neurological conditions can be better identified and treated at the community level. And so that is an assuming task. I'm very sure that, those initiatives which has been started long back by Dr. D. Nagaraja in terms of the caring the stroke patients and subsequently translated into multiple forms, and which are translated into a huge program today. And on behalf of each one of you, I take this opportunity to thank our former director, and also he started the very comprehensive stroke care management system. And we would like to thank you, sir. So we have an excellent the scientific advisory team, and in presence we have Dr. Prashant Mathur and also Indumati, and the entire team of the Brain Health Initiative, both Government of Karnataka and the NIMHANS team. And on behalf of all our participants from the medical officers, we take this opportunity to thank each one of you. I'm very sure that this is only a beginning and it's going to translate into the needy patients, their support system in the way to come. So on behalf of each one of you, thanks to the government of Karnataka, and also we will support from NIMHANS end whatever we could do it. Thank you very much. Dhanyavad, namaskar. Namaskar.
Given by the institute to the Getafe, many patients are being refused formalization because of poverty. So you should not be a trend. Oh, point taken. Thank you.
Thank you. I request all of you to rise and join in the singing of our national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागी तव शुभ आशीष मागी गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
This culminates today's program. All of you are invited to join for lunch, and the PHC which is in the first floor. All the PHC doctors are kindly requested to collect your certificates from the registration desk. Thank you, Dhanyavad Guru, and Jai Hind.